Today our topic is Patau Syndrome. This was first identified and observed by the Danish physician named Thomas Bartholin. Dr. Klaus Bartom made asserting information and data about the disease, which is why the condition is named after his name. Patau Syndrome. This is a rare, serious genetic disorder caused by having the additional copy of the chromosome 13 in some or all of the body cell. Causes for the Patau syndrome: extra DNA from the chromosome 13 appearing in some or all of the body cell. The presence of the extra chromosome 13 in all of the cell. Mosaicism: the presence of an extra chromosome 13 in some of the cell. Partial trisomy: the presence of part of the extra chromosome 13 in all cell. So this causes the Patau syndrome. Humans have the 46 chromosome. 23 from your mother and 23 from your father. Women have 2 X chromosome and men have 1 X and 1 Y chromosome. But in non-disjunction, the failure of the homologous chromosome to separate properly during the meiosis, this is called non-disjunction. In the Patau syndrome, there will be the severity disrupts that normal the development and in many cases results in a miscarriage, stillbirth, or the baby dying shortly after the birth. Babies with the Patau syndrome grow slowly in the womb and have the low birth weight along with a number of other serious conditions that causes the medical problems. Patau syndrome affects more than 9 out of 10 children born with the Patau syndrome die during the first year. About 5 to 10% of the baby with the less severe forms of the syndrome, such as partial or the mosaic trisomy 13, live for more than a year. They have the left clip of the palate, polydactyl, microcephaly, rocker bottom feet, closed set of eyes, and the small eyes or no eyes. They have the kidney problem. People have the heart failure, no abdomen wall, malformed ear, umbilical hernia, testicles that have not descended, seizure, intellectual ability or the mental retardation, hands are clendered or folded, defects in the scalp, abnormalities of the skeleton, sleep apnea and the hypertension. Patau syndrome, they have the small mouth, small jaw and short neck. They have the shield chest or the short and the prominent sternum and the wide set of nipples. The occiput or the back part of the skull is prominent. Dysplastic or the malformed ears, clenched hands with the overlapping fingers, flexed big toe and the prominent heels. Small head, absent eyebrows, cleft lip and they have the palate. They have the dysplastic or the malformed ears, clenched hands and the polydactyl or the extra fingers, undescended or the abnormal testes. Treatment and the management: there is no cure for the Patau syndrome. However, the following measures may be taken to fix the symptoms: surgery, tube fed, occupational, physical and the speech therapy. More than 80% of the patients do not survive beyond the first month of their life. Over 80% of the sufferers do not live for more than the first years of their life. Unilateral left clip on the palate, left eye was underdeveloped. Heart had many defects such as the large ASD and VSD. And her left aorta was severely deformed and the tapered off. In the first 6 months of this baby, she had her left clip repaired at the 7-month-old at about a year, and some she had palate repaired. An extra chromosome only means that I am the extra special, don't be jealous. So this is the basic about the Patau syndrome.